we have a balance in our central nervous system. We have the fight or flight. That's what we call the sympathetic system, the adrenaline system. And then we have the vagal system, which slows things down. They keep each other in track. And some people have a little bit more fight or flight. Some people have a little bit more vagal. And some people get excess fight or flight. And that's due to a lot of reasons. In her case, metabolic imbalances. We put a lot of trash in our system. A lot of chemical preservatives in our food, various other things go in and throws the body off balance. So we may have more adrenaline. Versus in some cases, we may have more vagal. That may have something to do with the gut. The microbiome may be imbalanced too. And so there are lots of things that can be going on with the body. And by optimizing nutrition, it actually feeds the microbiome. It actually puts you in better balance. Welcome to Montgomery Heart Wellness. We're here at our health center and we just finished rounds, and we're going to discuss a few patients that we saw today. So who has the first patient?
I have patient Gigi. She is a 69-year-old female who came in because she had a 4.1 centimeter ascending aneurysm that she was diagnosed in December of 2020.
So it's a 4 centimeter ascending aortic aneurysm.
Yes.
When was that diagnosed?
December 2024.
Okay.
And her goal was to see if we can be able to either reduce that aneurysm or not have it get any bigger. During that time, she was also complaining of chest pains that were occurring 3 to 5 days per week and some upper back pain, basically generalized pain. We did a comprehensive lab on her cardiac workup. She was placed at EBO, some infusion therapies, Plec X. She also got on premium greens and D3 with K2. On the second week of seeing her, she was saying that she felt a bit better, like her energy increased. The pain was gone. The generalized pain that she complained of was gone. We reviewed her labs with her. Her lipoprotein A at the time was elevated. It was like 519. LDL was elevated 126. But we're going to recheck those labs at the end of her therapies with this.
So we're checking inflammatory markers like a C-reactive protein or sed rate. The beginning of those, were any of those elevated?
No, just the lipoprotein A and LDL and the myeloperoxidase.
So the interesting thing about this patient, she presented essentially a chief complaint of a dilated aortic aneurysm. But then she had these other complaints. Now, Joan has pain. Did she have chest pain, discrete chest pain also?
Chest pains that she said were occurring 3 to 5 days.
Was like a sharp stabbing pain, or tightness or pressure, do you know?
I think she said more of a pressure, yes.
She did have a lot of hip and knee pain. That has gone down a lot.
Mm-hmm.
And we still also ordered a perfusion study as well because of the high lipoprotein little a and LDL. She hadn't had that checked, so a lot of that could be coronary actually in nature.
So this is an interesting patient as you put it together. Let's start off with dilated aortic aneurysm. And one thing that I like to show the audience and you guys is that when an individual has a certain complaint, from a clinical standpoint, you want to have a list of possibilities as to what can cause that one thing. So let's say we take the aortic aneurysm. It's dilated, and so what can cause a dilated aortic aneurysm? I remember in medical school we have morning report. So let's say somebody presents that case, and they may cut them off right there. This 69-year-old lady coming with dilated aortic aneurysm, stop, Montgomery. What's your differential diagnosis? So what are the list of possibilities that can cause a dilated aortic aneurysm? Well, hypertension is one. Systemic inflammatory disorders are other. Vascular disease, atherosclerosis is a possibility. Okay? Syphilis. Anybody want to take a guess at how syphilis can cause a dilated aortic aneurysm?
It can cause like a vasculitis and systemic inflammation. I mean, it can degrade your neurological system too.
Yeah. I'm asking an unfair question since you were brave enough to answer. What's the Latin word I'm thinking of that means vessel of the vessel? It's not unlucky in my Latin, but it's just vasa vasorum. It's the vessel of the vessel. So you know what I'm talking about. Tell me, share?
The infection itself, like in the vessels or the supply for the
blood vessels.
Yeah, the vessels that supply vascular flow to the aorta become diseased with syphilis. Do we think she has syphilis? No, not necessarily. But if you don't think about it, you'll never diagnose it. So then what else goes up with a differential diagnosis?
More like autoimmune or connective tissue disease.
Connective tissue disease. So then that becomes more prominent as a potential cause. Then you mentioned what? LP(a) is being elevated. So atherosclerosis is another cause. So we want to put these things together in terms of what are the possibilities, because then that's going to direct what other tests we do. We don't want to just randomly order tests. Given the possibilities of autoimmune and vascular disease, we came up with a treatment plan, because even though we don't have a direct diagnosis of what's happening, we know that if we treat these both conditions can be treated in a similar fashion, which is what? Nutrition, anti-inflammatory, the ozone treatment helped. Even though we didn't have discretely elevated inflammatory markers in the blood, we had good clinical symptomatology of systemic inflammation. And by the way, normal inflammatory markers in the blood does not rule out a systemic inflammation, because systemic inflammation is all tissue-based. And oftentimes you have to get tissue, which you can't always do. So she improved significantly in what period of time with this treatment?
In about 2 weeks.
Wow. So 2 weeks' time, she got better with this therapeutic approach. Where are we now in her course of workup and treatment?
So she has been in Houston because she moved to Houston just for the treatment. So she's been in Houston for like 3 weeks now.
So I think she has 1 more week. Then we'll redo all the tests and review her other heart scan. But her blood pressure's been coming down. So I think at the top of our differential was just hypertension and atherosclerosis as the cause of the aneurysm, because she's been diagnosed with osteoarthritis. But, we tackle it with those treatments like the ozone and the diet, because that helps all the cells and all your tissues get better from really any disease process.
Yes. And were we able to wean any medications yet, or are we still working on that?
Currently, she's just taking amlodipine, the 10
So
milligrams.
just one
medication.
I think she was on 2 blood pressure meds.
Okay.
And now she's on 1, and probably next visit we'll reduce it or stop it.
Wow. So very exciting case. The patient come in with a aortic aneurysm, and it'll be exciting to know if that aneurysm decreases. Typically what we do is we'll have them follow up with a thoracic surgeon. So when she goes back, have her see a thoracic surgeon. They can follow up on a regular basis to make sure somebody's observing this on a regular basis. But we may repeat some imaging over time ourselves. So fascinating case. Again, it shows you how this approach can have an impact in a fairly short order. But the thinking must be broad. We can't just on a willy-nilly basis give a drug or do a test or prescribe a treatment unless we think about what's happening. Who is the next patient?
This patient's name is EJ, and he's a 66-year-old male who was diagnosed about 2 years ago with non-ischemic cardiomyopathy and heart failure. He's also had a history of atrial fibrillation, a stroke, and multiple myeloma. And so initially he had been seen at our clinic wanting a more integrative approach and having shortness of breath with mild exertion, requiring diuretics at that time, and having more frequent hospitalizations for fluid overload and heart failure, and eventually was put on the milrinone infusion, which he went home on outpatient, which helps the contraction of the heart. It's not intended to be long-term outpatient, or it can have negative effects at that point. And so with us, he'd done the nutritional detox, he did the meal plan, he finally fully committed to the program, and he told us he felt like a different man. Even though he's 66, he now felt like he was 45. He wasn't even using his diuretics every day of the week at this point, and we had made a realization that we needed to upgrade his regular dual chamber implantable defibrillator to the resynchronization therapy device, because he had similar to a left bundle branch block morphology, and by synchronizing the heart, that can improve cardiac output And we wanted to see if that would improve some signs we saw of multi-organ dysfunction with the thyroid, adrenal glands, kidneys, and liver. And his blood work was making good improvement in all those areas. So we're still working with him, but our goal is to wean him off this milrinone infusion that he's on at home and continue with the plant-based.
So this is a very, very complex patient. So you can multiple myeloma, heart failure, was put on a milrinone pump. He had, chronic kidney disease. He had adrenal. That's about 4 or 5 different specialists right there, okay, who may come in and provide different types of treatments. And a patient with this type of a presentation, hospitalized frequently, his condition was declining. So here you have someone with life-threatening heart failure on a milrinone pump. For those of you who are not familiar, milrinone is a medication that's given intravenously and is given to patients with severe heart failure. Typically, patients who are near on their last, leg for heart function, and it's oftentimes the last treatment just before they go for transplant or mechanical assist device for the heart. So he was at this level of treatment for his heart failure, and there was other organ dysfunction, as you mentioned, the kidney, adrenal glands, liver. You can almost argue that here's someone who's on the threshold what we call cardiogenic shock. In other words, his heart is so weak, it's not perfusing or circulating the blood adequately to the different organs in the body for them to function normally. And so you have a situation where the central part being the heart, but also the chronic illness itself could be, you have a primary chronic adrenal gland problem, you have a primary chronic liver problem. So you have multiple organs that are failing independent of the heart failure. Was it early signs of multiple myeloma? Did they diagnose him with it? Or they just had some?
That's been diagnosed. He actually went through a treatment, I believe it's Revlimid in the past, but his specialist said was staying pretty stable. So we've been watching the pancytopenia, the platelet count, the red blood cells, white blood cells, and just monitoring that.
So pancytopenia means it's basically across the board. It's pan, cyto, cells, penia, small or decrease in number. So he had a decrease in number of white cells and platelets and red cells. So he's anemic, low white count, and multiple myeloma is dysplastic disorder, can have what we call a systemic inflammatory effect on the body. So the body's immune system was in part probably attacking itself. That may contribute to the other organs dysfunction. So here's somebody with severe chronic illnesses that would typically require the work of about 4 or 5 specialists. And you can imagine a list of treatments and medications he would be on. But what do? We put him on a targeted nutritional regimen, which cuts at the core of all of those illnesses. Now, there were other things we do. Now, this gets at the heart of integrative medicine. So we did not ignore the nutrition despite the complexity of his illness. Oftentimes doctors see a patient like this says, well, nutrition has no role. He's too sick. Let's fix this up first and we'll deal with that later. No, nutrition is first and foremost. And so that's what we always do here, nutrition. Now, the diet varies depending on what the illness is and how aggressive we are. So we put them on a specific nutritional regimen based on food classification system that was target for his illness. Now, we also did not ignore the allopathic treatment. So we recommended for what's called cardiac resynchronization. Oftentimes when the heart is weak and you have an abnormal conduction system, the electrical signals from the upper to the lower chamber is abnormal such that the lower chamber on the right will squeeze before the lower chamber on the left. And so instead of the 2 ventricles squeezing like this, they'll squeeze out of synchrony. And so that creates an abnormal circulation or inefficient circulation, which can worsen heart failure. So by just simply synchronizing those 2, you can give a lot of benefit for the heart and improve circulation. So that was something that we added to the list of things we did. So we're not so dogmatic to say, well, just only nutrition. And we're not so dogmatic to say only resynchronization. We put the 2 together and they have a synergistic effect. We left them on the milrinone because there were other things we wanted to do to let his body heal. But we know that you don't want patients on milrinone for a long period of time. What do you know about milrinone? There was a study, I don't know if you remember, a study done on patients. I think Pfizer came out with an oral form of milrinone. And what did they find in that study? You remember?
I think after 6 months, outpatient increases risk of death from cardiovascular causes because it can increase ventricular arrhythmias and cause sudden death.
So milrinone kills after a certain period of time. So we know the pill kills, the IV kills. So we can't leave on this drug for too long. Again, that integrative approach makes a difference. So with the nutrition, and even before the resynchronization therapy, he was getting better with just nutrition. Target supplementation. We did some medication weaning in the interim to a certain extent. Polypharmacy can have an adverse effect. Too much diuretics, too many other medications, in fact, other organs. Plus we put on supplements for the adrenal gland. So we had a multifaceted approach with this patient and saw the improvement. And he's getting much better. He's feeling better. We've reduced the medication. And the next phase is to start weaning the milrinone. And we're going to do that in an organized fashion with close follow-up. And again, we don't do these things in a haphazard manner. These patients see us weekly, sometimes every other day. Some patients see us 5 days a week while we monitor their condition. And we also wean their medication. So again, this integrative approach can be very effective, very powerful, but it's done in a controlled setting, and it's done in a very direct, intentional way. So excellent. So we look forward to getting follow-up on this patient with his complex disease, but he's already on the course for improvement. So who has the next patient?
Okay, I do. So I'm presenting for a 9-year-old female. The first time we saw her here in the clinic was 6 months ago. Initially, she came complaining of palpitations. This is the main symptom. Chest discomfort and generalized muscle pain or joint pain. Her history consists of a diagnosis of thalassemia trait. Also, she have a history of venous insufficiency, costochondritis, also fibrosis, so a lot of things, and also diagnosis of anxiety. So we run a lot of tests, blood tests and echocardiogram, and also we put a heart monitor to evaluate the heart rates and the palpitation.
Let me take a pause here. So, the very interesting constellation of symptoms. I know we have more data you're going to share with me, but I'm just going to share my thinking with the audience right now, because this reminds me of the old morning report, right? You come in, blah, 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 blah. Oh, what do you think? So let's just put these things. Palpitations she has. She also has a history of anxiety. Now, what does palpitation and anxiety have to do with each other? Well, I'll get to that in a minute. She also had venous insufficiency and a thalassemia trait.
Yes.
So let's take the palpitations. Palpitation is a complaint that patients give, and we don't always know what it means. Someone comes in and says, oh, I have palpitation. Patient A will have palpitation. That's what do you mean? I have a skip beat. Patient B has palpitation. Well, my heart's racing like it's about to jump out of the chest. Patient C has a palpitation. It kind of quivers irregularly off and on. What were her palpitations like? Rapid, pounding, skip beat?
Yeah, rapid. That's what she mentioned, that she feel like her heart racing.
Now, would it gradually rev up or just come on all of a sudden and stop all of a sudden? Do you remember?
Actually, she mentioned that she just feel it and then stop and then it comes
back. Yeah. So that's an important characteristic, because when you feel it like that, it makes me think more of an arrhythmia, an abnormal heart rhythm. Abnormal heart rhythm can vary from anywhere from the upper chambers, atrial fibrillation, atrial flutter, lower chamber, ventricular fibrillation. Not that you pass out, but some people get ventricular fibrillation. It comes on and off. Ventricular tachycardia, PVCs. So you can get abnormal heart rhythms that's all of a sudden on, all of a sudden off. Occasional skip beats are like isolated beats like PACs or PVCs or premature beats in the upper and lower chamber respectively. So it seems like she had an arrhythmia, which could be maybe supraventricular tachyarrhythmia or atrial flutter or atrial fibrillation. Those are possibilities. What might that have to do with the anxiety? We know that certain mineral deficiencies, magnesium being one we see frequently, zinc deficiencies can also cause this, but magnesium deficiency can be associated. Does she have insomnia?
Yes, she has insomnia, and one of the tests we did is like the micronutrient test.
So again, we'll look for magnesium. So this is, I don't know the results of the test, we're going to find out, but we want to think about these things. So in the differential, is there all anxiety, palpitations, Well, magnesium is a common denominator. Zinc could be a common denominator. And if they have insomnia, that's the third thing. So these are possibilities, and so we may look at that. And we've had patients come in with a constellation symptom similar to this, and we just put on magnesium supplement. By the time they come back, they're feeling better, they're sleeping better. So sometimes you may have a simple solution to something that seems like a complex constellation, where in some cases, the doctor may give you an antiarrhythmic, then they give you a sleep medication, and they give you something else for anxiety. Sometimes simple solutions will be there, so you put some time thinking about it. I just want to share that with you. So why don't you go ahead and tell us what we found, what we did.
Okay, so the complete blood count showed like low iron levels and like low hemoglobin. There is some deficiencies in the micronutrient test, but we put this patient on nutritional regimen, and on the follow-up next time she showed improvement. Actually, over these 6 months there is marked improvement. We can say like every time we're monitoring the heart rate and it's like about more than 80%, we get like normal heart rate.
She didn't have an arrhythmia, it was just the heart rate was just fast.
Yeah.
And the palpitations were there on one side versus the other. I remember this patient, we talked about her. She was prescribed the beta blocker, but she was afraid to take it. She was a little bit anxious in general. And when she came back, the anxiety was gone. Now, we did put her on a heavy dose of magnesium, which probably helped some of that. The nutritional thing put her in metabolic balance. And so oftentimes it's not just one micronutrient, but it's an imbalance across a whole spectrum of things, some of which we can measure, some of which we can't measure. And so as she became better nourished, inflammation went down, biochemical and physiological balance came into play, her tachyarrhythmia, and she probably had a high sympathetic tone. And with that high sympathetic tone, that's probably why she had such a high heart rate. That sympathetic tone was decreased. What I mean by sympathetic tone, we have a balance in our central nervous system. We have the fight or flight. That's what we call the sympathetic system, the adrenaline system. And then we have the vagal system, which slows things down. They keep each other in track. And some people have a little bit more fight or flight. Some people have a little bit more vagal. And some people get excess fight or flight. And that's due to a lot of reasons. In her case, metabolic imbalances. We put a lot of trash in our system. A lot of chemical preservatives in our food, various other things go in and throws the body off balance. So we may have more adrenaline. Versus in some cases, we may have more vagal. That may have something to do with the gut. The microbiome may be imbalanced too. And so there are lots of things that can be going on with the body. And by optimizing nutrition, it actually feeds the microbiome. It actually puts you in better balance. So it's pretty interesting with her. The nutrition went a long way, as well as targeted micronutrients. So she felt better, less anxious,
Yes.
sleeping better.
Sleeping better.
And she's coming with this tablet with all of the symptoms.
Yeah.
The last visit, she had no tablet.
Yeah, because she's not more feeling like the fast heart rate. She can sleep well.
Yeah, we weaned some medications too. So again, a remarkable case, a spectrum of conditions, typically are very, very difficult to manage and treat. But if you take a foundational approach, which is nutrition, target micronutrient supplementation for biochemical balance achievement, you can get a lot of benefit in a very short period of time. So anyway, I hope this was helpful to you as it was to us, and welcome again to our inaugural episode of Clinical Review, and we look forward to seeing you in future episodes. Until then, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.